Okay. Thank you. Good morning, everyone. Hope you're all doing good. Good morning, everyone. Hope you're all doing good. Today the topic is shock. This I do it in 2 classes. Today I'll be dealing with first part of shock. So what is shock? Shock, it is a syndrome. Shock or circulatory shock are one and the same. Shock is a syndrome. What do you understand by syndrome? Syndrome is the collection of different entities having some common features. That is a syndrome. So, shock or a circulatory shock is a syndrome characterized by serious reduction of tissue perfusion with inadequate cardiac output. So, the cardiac output is less. That is why tissue perfusion is not happening in shock. This is very important. If you understand this, you can understand the rest easily. So there is inadequate cardiac output. That inadequate cardiac output, it could be absolute or relative cardiac output. Because the cardiac output is less, the tissue perfusion is less. Or in other words, shock is a condition characterized by inadequate delivery of oxygen and nutrients to critical organs such as heart, brain, liver, kidney and GIT. Because there is no nutrition to these important vital organs, that is shock. So we'll see. So depending upon cause of inadequate cardiac output, the circulatory shock is divided into 4 types. So depending upon this, we can divide shock into 4 types. First is the hypovolumic shock. Second is the vasogenic shock. Third is the cardiogenic shock. And fourth is the obstructive shock. Here one and the very important thing is there is decreased cardiac output. So perfusion to the tissues is not there. So each one is different. We will come to each and every one. So first one is the hypovolumic shock. So hypovolumic shock, what do you understand by the word hypovolumic? Means something in the volume, blood volume is less. So volume has decreased. So in what conditions do you see this? Coming to hypovolumic shock is also called as cold shock. Whenever a person enters this type of shock, his skin will be cold. That is why it's also called as cold shock. It occurs due to low blood volume, resulting in decreased cardiac output. Okay, depending on causes, this shock is further divided into following types. One is hemorrhagic shock. So blood volume is less in this because there is something is coming out from your circulatory system. So hemorrhagic shock. So hemorrhagic shock is a result as an internal or external blood loss. Internal blood loss. When do you get internal blood loss? During surgery you can have internal blood loss, or sometimes there will be aneurysm of aorta. Aorta will rupture in some people. So you will have an internal blood loss, or external blood loss you can have during accidents. So because the hemorrhage, the blood subject is losing blood, that is why your blood volume is less. So due to ruptured blood vessels, you can have this hemorrhagic shock. Next one is the dehydration shock. Dehydration shock means your body is having dehydration because there is fluid loss. So fluid loss leading to low blood volume. So this fluid loss could be in GIT. You can say it as your diarrhea or vomitings in GIT. When it comes to your kidneys, diabetes insipidus, diabetes mellitus, or using lot of diuretics will deplete our body and we might end in dehydration, or skin during burns. All this is dehydration shock. Here fluid loss is there because of the following conditions what I have told you. Okay, this is another type of shock. Third one is the traumatic shock. In all this all comes under hypovolumic shock. The volume is reducing either because of blood or depletion of fluids. Traumatic shock. Traumatic shock, it is this traumatic shock when there is severe damage to your muscle or bone. Severe damage, so lot of blood will go into the injured tissue. So that tissue, supposing in thigh, when there is damage to your thigh can accommodate 1 liter of blood but it will only expand by 1 centimeter. So thigh can accommodate that much of blood by expanding only 1 centimeter. So, or sometimes if the muscle is severely crushed, crush injury, so lot of myoglobin is released from the muscle, and this myoglobin gets precipitated and clogs the renal tubules, causing the renal damage. So this is traumatic shock. When there is trauma or injury, they produce a severe pain, and this will inhibit the vasomotor center in the medulla oblongata, leading to shock. So in hypovolumic shock, we have seen hemorrhagic shock, we have seen dehydration shock, and the traumatic shock. All this is because of loss of fluid or blood. That is why we have less blood volume and less cardiac output. So less tissue perfusion. The next one is vasogenic shock. In vasogenic shock, because of the neural reflexes or some toxic substances are released by the pathogens, which will lead to excessive vasodilatation within the vascular system. Because these pathogens will cause excessive vasodilatation within the vascular system or within the vessels. This vasogenic shock is warm shock. Hypovolemic shock is a cold shock. This is a warm shock. So, but in this, what will happen when there is excessive vasodilatation? Your capacitance vessels will hold lot of blood. So, the blood coming to the heart has decreased. So, your cardiac output is decreased, but the blood volume is normal here. Blood volume is normal, but it is all getting accumulated in your capacitance vessels. So, blood reaching your heart is less. So, your cardiac output is reduced. So, depending upon causes, vasogenic shock is further divided into following. Neurogenic shock. Neurogenic shock means there will be transient loss of consciousness in this, because there will be decreased blood supply to the brain. Your cerebral blood flow has decreased. Why it has decreased? Because of increased vasodilatation of your sympathetic system, or because it has decreased, because sympathetic tone has decreased a lot. Decreased sympathetic tone or increased vagal tone, and this will lead to bradycardia and hypotension. But this is, and the subject will become, it is very short-lived. It's very short-lived, and the person will regain consciousness in a very short time, within no time. Okay, within few minutes, the person will regain his consciousness. It is benign. Okay. Next one is the anaphylactic shock. Anaphylactic shock means it refers to acute allergic reaction in which large quantities of histamine and histamine related substances due to allergy are released. These substances will cause vasodilatation. So this will decrease your peripheral resistance. It will cause the vasodilatation of the blood vessels, and because of this vasodilatation, there will be increased capillary permeability. So to this angle, your hypovolemic shock also is added. So because of the increased capillary permeability, your blood volume has decreased. So anaphylactic shock, to this even your hypovolemic component is added. Okay, this is anaphylactic shock. Septicemic shock. Septicemic shock, it is a condition in which bacteria will circulate and multiply in the blood, okay, and form toxic products, and this causes high fever and vasodilatation. So in all this, there will be vasodilatation of the blood vessels, so the blood reaching the heart is less. So that your stroke volume, cardiac output is less. That is why the tissues will not get the perfusion. So this is about your vasogenic shock. Excessive vasodilatation is there because sympathetic tone has decreased. Coming to the next one is a cardiogenic shock. So cardiogenic means something to do with your heart. It occurs due to decreased pumping ability of the heart, because there is some abnormality in the heart. So pumping ability of the heart has decreased. So cardiac output has decreased. So what are the causes of this shock? Are myocardial infarction. When there is myocardial infarction, when there is cardiac arrhythmias, when there is congestive cardiac failure, or when there is severe valvular dysfunctions, all this will lead to the decreased pumping ability of the heart. So your cardiac output has reduced. So this is cardiogenic shock. The last one is obstructive shock. Obstructive means something is obstructing your heart. That is why your heart is not able to pump out the blood. It occurs due to impairment of ventricular filling during diastole. Your diastoles, when they have to get filled, they are not able to fill up because there is some external pressure on the heart. So due to decreased ventricular filling, your stroke volume is reduced and hence your cardiac output decreases because during diastole your ventricles are not getting filled up because there is some pressure on your heart. So what are the causes of this? Pericardial cardiac tamponade means bleeding into the pericardium. So bleeding is occurring into the pericardium, putting the external pressure on your heart. So heart is not able to dilate during the diastole. So pulmonary embolism. Other reason is pulmonary embolism. Embolus formation occurs in the pulmonary vein. There is an emboli in the pulmonary vein so that no blood reaches your left heart. So your cardiac output is reduced. So these are the obstructive shocks. So we have seen 4 types of shocks. What are they? First one is hypovolumic shock. Second one was the vasogenic shock. Third one was the cardiogenic shock. And the fourth one is your obstructive shock. In all this, your cardiac output has decreased. So tissue perfusion has decreased. Okay. So these are different types of shocks. Now coming to the next one, stages and clinical features of shock. All the shocks are almost have got the same symptoms, maybe with some minor differences. And all these stages depending upon here we are going to study about the hemorrhagic shock. That is one type of hypovolumic shock because that is the most common one we deal in day to day. So we are going to talk about your hemorrhagic shock, hypovolumic shock. So in this depending upon the stages of this circulatory shock, it can be divided into 3 stages. First stage is also called as non-progressive shock. Second stage is called the progressive shock. And the third stage is called the refractory shock. So these 3 stages will come to it one by one. So today I am only going to talk about the non-progressive shock. Progressive and refractory shock, I will take it up then in the next class. So non-progressive shock. So in this non-progressive shock, it is also called as compensated shock. Here there is moderate reduction in the cardiac output. How much the cardiac output blood volume has reduced? It occurs after loss of 10 to 15% of the blood volume. Here 10 to 15% of the blood volume is there. If the loss is less than 10, we can't even see any difference. But when the loss is about 10 to 15% of the blood volume is there, so some compensatory mechanisms will occur. What are those compensatory mechanisms? So whenever our cardiac output has reduced, so body has to do some adjustments so that to maintain the blood flow to the vital organs. It has to maintain the blood flow to the vital by increasing the blood pressure. Then only your vital organs will get the blood. So what are the immediate compensatory? This we can actually only 2 it is showing, but there are 3 mechanisms. One is the immediate compensatory mechanism, the second one will be the intermediate compensatory mechanism, and the third one will be the long-term compensatory mechanism. Today we are going to talk about these 3 mechanisms. Immediate compensatory mechanism. So immediate compensatory, how the blood flow has to be maintained to the vital organs. Immediate will be your baroreceptor mechanism, including 3 nervous reflexes. So immediately compensatory mechanism, this is all neural. So it includes 3 nervous reflexes. What are they? Baroreceptor reflex, chemoreceptor reflex, and CNS ischemic response. While dealing with BP, you must have heard all these reflexes. So coming to one by one, so 3 nervous reflexes for immediately whenever there is loss of the cardiac output, whenever the blood volume has reduced, these are the 3 immediate reflexes that will come into play within seconds. That is why they are called immediate compensatory mechanisms. Coming one by one, baroreceptor reflex. So baroreceptors, They are stretch receptors which sense changes in pressure. Okay, baroreceptors are the stretch receptors which sense change in the pressure. Whenever there is a pressure is less or more, they sense them very quickly. Okay, so where are these baroreceptors present? Now I am talking only about the baroreceptors. So baroreceptors are present in the carotid sinus and the aortic arch. Baroreceptors are present in the carotid sinus and the aortic arch. Okay, so here I am showing those. So these are the aortic arch receptors, and these are your carotid sinus receptors. Carotid sinus receptors and aortic arch receptors. Okay, so carotid sinus or carotid body, for chemoreceptors it's carotid body. They are innervated by the glossopharyngeal nerve. Aortic arch and aortic sinus is innervated by your vagus nerve. So what will happen whenever when the BP falls? When the BP falls, what will happen? There is less pressure on these baroreceptors. So these baroreceptors get inactivated. So when they are inactivated, your firing level from the 9th and 10th cranial nerves to the nucleus tractus solitarius is also inhibited. It is not much. So this will stimulate your vasomotor center. So this will reduce the inhibitory effect or stimulate the vasomotor center is one and the same. So they stimulate the vasomotor center. How? So what does this vasomotor center do? It will do generalized vasoconstriction of all your arterioles and veins. Okay. So a generalized vasoconstriction will be there everywhere. So where all the vasoconstriction will be there? Skeletal muscle, smooth muscle, that is your splanchnic circulation, that is GIT. Then your arteries, arterioles, venules, everywhere there will be constriction. So whenever this constriction is there is increased amount of blood will come into the circulation. So your BP has increased. Okay, but everywhere vasoconstriction is occurring except to your brain and the heart. Brain and the heart are auto-regulated. Okay, but when this increased BP pressure is there, it will maintain the blood flow to these vital organs. So this will increase your BP and the heart rate. So baroreceptor reflex is very important and will come into play within seconds. The next one will be your chemoreceptor reflex. Where is this chemoreceptor reflex? Chemoreceptors present, they are present in the carotid body and the aortic body. So carotid, same thing, carotid body is innervated by the glossopharyngeal nerve and aortic body is innervated by your vagus nerve. So this is your carotid body. You see here, this is a keyboard, and this is your aortic. Aortic body is also present near your aortic arch only. So it's not shown in the diagram. Carotid body. Okay, carotid body. These are for your chemoreceptors. So when does this chemoreceptors get activated? Whenever there is some change in your blood chemistry. So whenever there is hypoxia, hypercapnia, acidosis. So whenever I say when the blood pressure fall below 70 mmHg means what is this? This is not systolic or diastolic. It is mean arterial blood pressure. Whenever we talk only about one pressure, that means your mean arterial blood pressure. When the blood pressure falls below 70 mmHg, because chemoreceptor reflex gets stimulated. So whenever there is lot of blood loss, your RBCs also will decrease. This will lead to anemia. So when there is decrease in this RBCs, your oxygen carrying capacity has also decreased. So there is hypoxia, hypercapnia, acidosis, all this will happen. When this happens, it will stimulate your vasomotor center, and this vasomotor center will bring your blood pressure and your heart rate up. Okay, so this is your chemoreceptor reflex. And one more reflex is the CNS ischemic response. It's the most powerful mechanism. When the BP falls below 40 mmHg, there is ischemia of the vasomotor center. So there is no blood supply to your brainstem. Vasomotor center decreases, leading to CNS ischemia. So whenever there is ischemia of vasomotor center, there is hypoxia. There will be hypercapnia, accumulation of lactic acid. All this will lead to the powerful stimulation of your vasomotor center. So there will be increased sympathetic discharge from this vasomotor center, and it will bring back your blood pressure, heart rate, and the cardiac output. This is very powerful mechanism. That's why it's also called as last ditch response. If this can't go well, patient will not survive. So CNS ischemic response. So it is a very powerful mechanism which will increase the generalized everywhere your vasoconstriction in the body occurs. So, increase sympathetic discharge, that will increase your BP, heart rate, and the cardiac output. Okay, so these are your immediate short-term mechanisms. What are the short-term mechanisms we have seen? Immediate mechanisms: baroreceptor mechanism, chemoreceptor mechanism, and the CNS ischemic response. Now coming to the immediate, so whenever these mechanisms are happening in our body, what are the signs and symptoms? We'll see pale, cold, and moist skin. Why pale and cold? Because of decreased blood flow to the skin. So it is pale, cold, and moist skin because of the increased sweating. Because of your increased sympathetic discharge, the skin becomes moist. Next one we see is cyanotic tinge of skin. Cyanotic, because of lot of extraction of oxygen from the blood, the skin will turn blue. Cyanotic tinge of skin we see. Then tachycardia. Tachycardia and because of this decreased pulse pressure or your stroke volume, you find the thin and thready pulse. This is what you see in hypovolemic shock. Tachycardia is one of the important signs during hypovolemic shock. Okay, then there will be increased rate and force of respiration. Increased rate and force because of your increased sinoaortic chemoreceptor discharge. Sinoaortic are nothing but this buffer nerves. Increased sinoaortic chemoreceptor discharge. That is why you see the rate and force of respiration increases. Okay, then because of the stimulation of your vasomotor center. Oliguria, renal arteriolar constriction will be there. Renal oliguria. Because of this renal arteriolar constriction, urine is very less. This is oliguria and is typical feature of shock. Okay. Then there will be restlessness and apprehension because of the stimulation of your reticular activating system. Why is that getting stimulated? Because release of catecholamines. Catecholamines are the powerful whenever there is blood loss, whenever there is hemorrhage, catecholamines from the adrenal medulla are the first ones to come out. They are powerful stimulation for your hemorrhage. So the catecholamines are released, and this will stimulate your reticular activating center, bringing about your restlessness and apprehension. So subject with shock will see all this: pale, cold, and moist skin, bluish skin, increased pulse rate, force of respiration, oliguria, and restlessness and apprehension. So we are finished with the immediate mechanisms. Now coming to the intermediate compensatory mechanisms. Intermediate compensatory, all this you must have done in blood pressure. So I am just brushing through this once again. So intermediate compensatory mechanisms are renin-angiotensin-aldosterone system is one, reverse stress relaxation is the second one, and the capillary fluid shift mechanism is the third one. So coming to the first one, renin-angiotensin-aldosterone system. This is very important because it will bring your BP back, and also your extracellular fluid. Also it will maintain the BP by increasing your extracellular fluid. Okay. So coming to reverse renin-angiotensin-aldosterone system. Okay. So when is this renin? Whenever your BP falls. So first, angiotensinogen coming from the liver renin will act on angiotensinogen 1. Renin is coming from your juxtaglomerular cells of the kidney. When does the renin release? Whenever there is drop in your blood pressure or drop in the fluid volume, renin will release. So renin is getting released from the kidney, from the juxtaglomerular cells of the kidney, and it is acting on this angiotensinogen 1 and getting converted to angiotensin 1. Okay. So renin acts, so it gets converted, angiotensinogen 1 is converted to angiotensinogen is getting converted to angiotensin 1 by the action of renin. Then angiotensin 1 is converted to angiotensin 2 by the ACE. ACE is what? Angiotensin converting enzyme. This is present in the endothelial cells of the blood vessels, particularly the lungs and the kidneys. So angiotensin 1 is converted to angiotensin 2. So what is the function angiotensin 2? Angiotensin 2 is a powerful vasoconstrictor. Here as you can see blood vessel is vasodilated, here vasoconstriction. Angiotensin 2 is a powerful vasoconstrictor. So it will act on all your arterioles, veins, arteries and bring about the vasoconstriction. Whenever this vasoconstriction is there, your systolic and diastolic BP will increase. And the other function of this angiotensin 2 is it will decrease the excretion of water and salts from your kidneys. Angiotensin 2 also acts on the efferent arterioles of the kidneys, so that your it will reduce blood flow through the peritubular capillaries. When the blood flow is reduced through the peritubular capillaries, there will be rapid osmotic reabsorption of water and salts. Okay, that is one more way it acts. And angiotensin 2 also acts on epithelial cells of the renal tubules. So it acts on the epithelial cells of the renal tubules by increasing the reabsorption of water and salts. And the angiotensin 2 also acts on the adrenal gland to stimulate the release of aldosterone. What is the function of this aldosterone? Aldosterone acts on the kidneys to stimulate reabsorption of salt and water. And also one more thing is this aldosterone, angiotensin 2 is also stimulates your thirst center. So whenever thirst center is stimulated, we feel thirsty and we take lot of water. This will increase your blood volume. So this is how renin-angiotensin system is the intermediate mechanism in case of shock. Okay, coming to the reverse stress relaxation. What is reverse stress relaxation? So all this is when BP falls due to prolonged slow bleeding. So we are all talking about hemorrhagic shock. So it's all about the blood, loss of blood from the vascular system. So BP falls due to prolonged slow bleeding. There occurs tightening of the blood vessel walls. Immediately there will be tightening of the blood vessel walls by the vascular tone adjustments, because secondary to slow stress on the walls, less stress on the walls, they become tightened, the walls become very tightened. So this mechanism, so your BP is increased because lot of fluid will enter the vessel, so your BP is increased. So this mechanism can correct up to 15% change in the blood volume below normal. So this is the reverse stress relaxation. Whenever there will be tightening of the blood vessel walls because of the vascular tone adjustments and fluid will come into the blood vessels, this will increase your BP. So this mechanism can correct up to 15% change in blood volume below normal. So this is the reverse stress relaxation. Coming to the third one, it is capillary fluid shift mechanism. When BP is low, mean capillary pressure will be low. Resulting when the pressure is low in the capillaries, it will result in absorption of fluid from the interstitial compartment to the circulation. So that will correct your blood pressure. So blood volume is lot of fluid from the extracellular fluid is entering your blood vessel. So blood volume is increased and BP is back to normal. So this mechanism is 2 times more effective than your baroreceptor mechanism in controlling the blood pressure. But because baroreceptor mechanism is an immediate mechanism that will act immediately. This is only intermediate action. It will take some time. So, but this is the most powerful mechanism, more effective than baroreceptor mechanism in controlling blood pressure, but it will take some time. That is why it is intermediate acting. Okay. So we have seen 3 mechanisms: renin-angiotensin-aldosterone mechanism, your reverse stress relaxation, and the capillary fluid shift mechanism. These are your intermediate mechanisms. So what are the long Term compensatory mechanisms, long-term compensatory mechanisms is you have to, when there is moderate hemorrhage, so you have to have the restoration of the plasma volume and proteins should be there. So how plasma volume slowly from the extracellular fluid within 12 to 72 hours from the extracellular fluid, this plasma volume gets corrected slowly. It will enter the fluid along with some electrolytes will enter your plasma, your blood volume, to restore your blood volume. So, but this blood volume, what has been restored, does not have much of proteins or the hematocrit. Actually, it is hemodilution of the blood will be there. But you want the proteins also should be there in your blood. So, these proteins will take 3-4 days. From where are these proteins coming? The proteins are coming from your extravascular source. The protein should come. So they are coming from the hepatic synthesis. So the liver is producing these proteins, and these proteins are entering your and these proteins are making up your blood volume. It will take about 3 to 4 days by the liver to get this protein. So restoration of plasma volume and proteins. Plasma volume will come, water will come from the extracellular fluid within 12 to 72 hours, but these proteins like your albumin and other proteins are coming after the liver synthesize these proteins. They are entering your blood. Okay, so that will take about 3-4 days by the liver. And meantime, what will happen? Meantime, the red cell mass has to be restored. So how will it come? There will be increased stimulation of the erythropoietin. This will act on your bone marrow and increase your blood cells. So that will take within 10 days. It will start within 10 days and it will fully restored by 4 to 8 weeks. Your blood cells also will come back. First the protein will enter the vessels, correct the blood volume, and then your RBCs and other cells also will enter. And this is about a long-term compensatory mechanism. It will take about 4 to 8 weeks. So with all these mechanisms, without any outside therapy, the circulatory shock, our body only corrects it. So it can be corrected within some time. Our own body mechanisms only will correct when the blood volume is lost up from 10 to 15%. So without any outside therapy, our body itself will try to correct all the circulatory mechanisms. But if outside therapy is there, our recovery will be faster. So here I am going to end about this. So today we have seen what is shock, different types of shocks, and we have seen the mechanisms, immediate mechanisms, intermediate mechanisms, and the long-term mechanisms. So in immediate mechanisms, we have seen baroreceptor, chemoreceptor, and CNS ischemic response. In intermediate mechanisms, we have seen renin-angiotensin-aldosterone mechanism, reverse stress relaxation mechanism, and we have capillary fluid shift mechanism. In the long-term mechanisms, we have seen how to restore the plasma volume and how to restore the red cell mass and how long will it take. So restoring of this plasma volume and red cell mass. So about your second stage of shock and third stage of shock, I'll talk to you, and the treatment part I'll talk to you in the next class. Okay, I'm done with it.